Well, hello, and thank you so much for joining us this evening for Dr. Richnack's presentation on alternatives to surgery. My name is Dana Nadeau, and I work very closely with Dr. Richnack on the Regenix side of his business. So again, thank you so much for joining us, and I will now introduce you to Dr. Joel Richnack.
Okay, well, hello everybody. I am Dr. Joel Richnack, and I want to thank you all for coming and watching our webinar tonight, in which I'll be talking about a field that I'm very passionate about, this field of orthobiologics, and how this technology really has proven to be a very powerful alternative to surgery for many of these orthopedic issues that we treat. As I say, a field that I'm very passionate about and hope to provide you with some more information regarding it. And as Dana said, we'll have an approximately 30 minute or so presentation. And at the end of that, we'll have plenty of time for questions and answering. So as we go through, jot them down, and we'll get to them at the end. So before jumping into the actual lecture, I want to talk a little bit about myself, a little bit more information about myself. I've been a practicing physiatrist here in Grass Valley for actually 19 years now, where I've been a managing partner along with my partner, Dr. Mike Jensen, in our clinic, the Mountain View Rehabilitation Clinic. And I am dual boarded in both physiatry as well as sports medicine. And in addition, I've been a Regenix provider for 7 years now. But to be fair, I've been practicing some form of orthobiologics or regenerative medicine since residency, so close to 20 years now. I think another important piece of information about myself is I've led a very active lifestyle for most of my life. I was fortunate to grow up in the mountains of the Sierra Nevada and enjoyed various movement forms, which initially just allowed me to pursue adventures and enjoy the beauty of the Sierra Nevada mountains. But eventually, the movement really triggered and sparked a deep interest in learning more about how this body works, and then certainly fueled my desire and eventually my decision to pursue medicine as a career. But in addition, like anybody who's active, I've had my own fair share of injuries. And although injuries are frustrating, and we've all been there and can be difficult to address at the time, but I have found that I've learned so much through every injury I've had, not only in terms of how to heal and get the body to heal as well as it can, but also to address these mechanical deficits that may have caused the injury or as a result of the injury afterwards. And by doing so, that combination of healing and addressing these biomechanical deficits, I've been able to get back to all activities that I've enjoyed over the years. And so from that standpoint, that's really helped shape the treatment philosophy here at Mountain View Rehabilitation. And that is, we really have a deep passion to get people back to doing what they love doing. So why are you here? Well, many of you are going through your own injuries and dealing with your own pain issues, and probably getting tired of the downtime and not doing these things that you love. Or you've been told that, or you want to avoid surgery, or been told that you're not a candidate for surgery. Looking for options if you've been deemed a candidate, and certainly don't want to rely on medications, and ultimately just want to get back to doing these things that you love to do. So in today's discussion, we'll spend a little bit of time discussing the basics, the current options in orthopedic care, which will then be followed by introducing this world of regenerative medicine, as well as interventional orthopedics and what's involved with both of those worlds. Then we'll spend some time talking about Regenix and what Regenix is, and how Regenix is far different than any other clinic offering orthobiologics. Then we'll spend a little bit of time about some of the misrepresentations of so-called stem cell products. And then, as mentioned earlier, we'll spend some time just going over some question and answering. So current options in orthopedic care really come down to, and many of you are familiar with this already, three categories: pharma, non-surgical options, and then surgical options. Many of us start in the world of pharma when we're trying to address these injuries, and it might start by just taking some over-the-counter medications. And if that didn't quite address things, then oftentimes we get prescription medications from our primary care physician, whether it be NSAIDs, opiates, or steroids. But ultimately, what we learn from this is these are only temporary band-aids at best. They're not really addressing the root of the issue. And then, of course, there's side effects to all medications, and some of these side effects are rather serious. And then kind of the next step in this adventure, if you will, of recovering from these injuries is the whole non-surgical world. And that may involve conservative treatments such as physical therapy, chiropractic treatment, acupuncture treatment, sports massage, bracing. And to be fair, I mean, most people respond to some sort of conservative treatment. At heart, I am a rehab physician, so I do strongly believe in the physical therapy model. In fact, I'll tell just about any patient that I see that there's really two goals to treatment. The first and foremost is to address the pain issue. And then once the pain's addressed, really focus on correcting the biomechanics, working on the rehab process. And by doing so, correcting these mechanics that, again, have either caused the injury in the first place or have been manifested from the injury. And again, the vast majority of people will respond to this approach. If we're having difficulty, however, addressing the pain issues, and sometimes we resort to these various injections. Most of the time we're using steroid, but in the case of knee arthritis, sometimes we'll use a hyaluronic acid injection, which is just simply a lubrication injection. But again, these do prove to be, in many cases anyways, band-aids at best, not addressing the actual root of the issue. But of course, steroid has many side effects, and something that certainly you don't want to repeat too soon or too often. And then traditionally, if all else fails, then oftentimes we'll get a referral to see one of our surgical colleagues to consider surgery, which usually includes repairing a tissue, removing a tissue, or replacing the joint. And this has been kind of standard of care for a while now. And many people do respond to this approach, but we're finding over the time that it's not the panacea of treatment. In fact, for many people, it can be ineffective. There are risks involved with the surgery itself, as well as the anesthesia. And again, sometimes it just doesn't always work. In fact, and of course, once done, it can't be undone. And interestingly enough, over the last 5 to 10 years, there's been far more research involving the efficacy and outcomes of surgery than there has been in the previous 60 to 80 years. And what this research is telling us is that although many surgeries are effective and people do respond, up to 53% of surgeries have been shown to be ineffective in clinical trials. So clearly the surgical model has holes in it too. It's not the panacea that I think many clinicians felt it was at one time. So this begs the question, what are the options beyond surgery? And that leads us into what we'll be talking about the rest of the evening, and that is this world of regenerative medicine. And that's just simply, in a nutshell, using our own cells, namely platelets and stem cells, which can provide healing. And in the case of injured tissue, can produce repair, such as the case with tendons and ligaments, meniscal tears, labral tears, nerve injuries, disc tears, etc. And then in the case of stem cells, can help alleviate symptoms of degenerative conditions such as arthritis. what can be treated? Well, in our clinic, we're treating all orthopedic issues from heads to toes. And so we address all joints. And each and every joint has various tissues, whether it be cartilage or the surrounding ligaments or tendons, or sometimes even in the bones. We treat all areas of the body, and you know, each of these specific joints have the various tissues that need to be assessed for injury, and if found to be injured, treated. Along with regenerative medicine, orthobiologics is this new field, if you will, of medicine called interventional orthopedics. And interventional orthopedics essentially is just simply taking technology, specifically ultrasound imaging and X-ray or fluoroscopic imaging. And what this does is it allows us to guide the injection, the treatment specifically to the injured tissue. And this is a specialty that really ensures the success of regenerative medicine. Anybody in this field who's trying to do these injections without guidance is going to be unsuccessful. Now, the correlate to interventional orthopedics is something called interventional cardiology. Now, many of you probably recall a time when anybody who had some sort of surgical procedure for the heart went to go see a cardiothoracic surgeon who, if deemed to be a candidate, would treat the patient by opening up the chest and directly accessing the heart. A smart cardiologist discovered that by the use of fluoroscopy or X-ray guidance, he could guide, he or she, I'm not sure which one it was, but could guide a catheter threaded through a vessel in the leg and guide it all the way up to the heart, where they could apply treatments such as stenting or removing tissue. And eventually, this proved to be such a successful model that it overtook 70 to 80% of what was once done through cardiothoracic surgery. So many of the leading minds in this field really feel that interventional orthopedics will have a similar game-changing effect, and within the next 5 to 10 years could address or replace as much as 70 to 80% of orthopedic surgery. And of course, this is needle-based, image-guided, and over 85 different injections done using your own cells. Now, taking a deeper dive in interventional orthopedics, understand that anybody involved in the orthopedic world, there's procedures that range from simple injections all the way to surgery. Now, a simple injection is something that anybody who's practicing orthopedic medicine does do. And essentially what that is placing a medication such as cortisone in the general vicinity of the injured joint. They may not even be provided with a specific injury or a specific diagnosis. They're just simply trying to get the medication in the general area in hopes that it can find its way to the inflamed tissue and offer a therapeutic effect. Now, with the advent of technology, there's more and more clinics offering these injections using ultrasound guidance. But again, they're not necessarily identifying the specific injury and are not necessarily targeting the tissue specifically. And this comprises up to 99% of physicians out there. An interventional orthopedist will first and foremost recognize and therefore identify that within one joint, say in the case of a hip, there's all these tissues that could potentially be contributing to the pain issues. Or it could even be a combination of several of these tissues, whether it be tendon, ligament, the joint itself, or even the bone. And then once identified, use technology, again, ultrasound imaging or fluoroscopy, or sometimes a combination of the two, to direct the procedure right to the injured tissue. So that's in the case of a hip. Similar applications apply to the knee. Again, there's several tissues that could be contributing to the symptoms. It's important to identify specifically which tissue is contributing to the symptoms and then targeting that tissue with guidance to apply the treatment. And likewise for the shoulder as well. What do we inject? Well, there's 3 products that we inject here at the clinic. One is concentrated platelets, otherwise known as PRP. Another is platelet lysate, which is a modified PRP injection. And then finally, we also offer stem cells. Platelet injections or platelet-rich plasma is cells that we get from a blood draw. And once the blood's drawn, it goes to the lab where it's processed into a very concentrated platelet solution. And then again, once done, injected into the tissue. And platelets offer various proteins that really instigate a powerful healing response. One protein is responsible for just mopping up the issue of chronic inflammation. And by doing so, it can help address pain as well as reboot that tissue's ability to repair itself. Another protein or cytokines or growth factors, I should say, really get that healing process up and going in a very vigorous fashion. Really, growth factors are what trigger the healing and all the vast number of players that combine to provide healing into the area to get the healing up and going. And so we're finding platelets working very well from mild to moderate arthritis, particularly in the hands and elsewhere, as well as tendon and ligament tears or meniscal tears or labral tears. Platelet lysate is taking that same platelet cell and then lysing the membrane that contains all the growth factors and cytokines. And by doing so, what we do with that is we get a much greater anti-inflammatory effect. And its impact is effective immediately, whereas PRP, it can take up to a week for it to disseminate. And it also disseminates the growth factor as well. And we're finding this particularly helpful and useful when it comes to nerve injuries, such as nerve compressions from a pinched nerve coming from the spine or even carpal tunnel. We also use stem cells, and this is a cell that we obtain from bone marrow. So there's an aspiration process. And stem cells are probably our most powerful healing cells. And the analogy to this is it's kind of like the conductor of an orchestra, if you will. And what it does is it signals and guides all these players to work in a harmonious fashion to create healing. And essentially, again, to turn bricks to mortar, so to speak. Again, we get stem cells from a bone marrow aspirate, after which it is sent to the lab where it's processed into a very concentrated stem cell procedure. And again, this cell is probably our most strongest healing as far as healing and repairing tissue. And this is used for more severe arthritis, as well as for more complete tendon or ligament tears. Now, the procedure breakdown that we do here at the clinic, probably 80% of what we do is platelet injections, the remaining 20% is stem cell, give or take. And that's significant because there is a cost difference. Stem cells procedures are much more involved, whereas the platelet is just a simple blood draw and a simpler process. And again, significant cost difference. Not everybody who is applicable to this treatment needs stem cells. Now, so that is, in a nutshell, what regenerative medicine is. What I want to speak to next is this company of Regenix, which I have been an affiliate for some time now. And just as an introduction, before I incorporated this field or this treatment technology into my practice, I vetted a lot of different companies, a lot of different systems out there, and ultimately came to choose upon Regenix simply because by far they were the most devoted to research. Understand this field is still very young. We're still learning a lot. So without the research, well, I should say the research is really integral to optimizing and making this technology as powerful and as effective as it can be. So they're devoted to the research. Other things about Regenexx is that they've been doing this for a long time. They have really surmised and brought to fruition many of the techniques that are done in interventional orthopedics, as well as in regenerative medicine. So again, I chose Regenexx in large part because of their devotion, their commitment to research. Now, as you probably have learned already, there's a lot of different options out there in terms of different clinics providing different sources of orthobiologics. What I want to spend a little bit of time next is just describing the differences as to why Regenexx is such a different process than any other clinic out there. And we'll touch upon each of these segments a little bit deeper, but we'll go over experience, clinical research, lab platform, the importance of image guidance, which we've touched upon a little bit already, data registry, which is the foundation of the research, if you will. It's comprised of specialists, the Regenexx company is. The cell source we use is different. The harvesting techniques we use are different. The dosing that we implement is different. So in regards to experience, as I alluded to earlier, Regenexx has been doing this far longer than any other clinic out there. And again, in fact, they've really invented and perfected many of the techniques involved in both interventional orthopedics as well as regenerative medicine. And what that means ultimately is outcome. With experience comes better outcomes. Our lab platform is profoundly different than any other clinic out there. Most clinics that are offering this procedure have a simple bedside centrifuge, which means that after the blood is drawn or the bone marrow is aspirated, they put the product in tubes, they hit a button on the centrifuge, and a few minutes later out comes the result, which means that there's not a whole lot of sophistication in terms of the processing. And it also means that everybody gets the same product. And we all know that we're all different in many different ways. So again, getting the same product for one individual may not work for another. So ultimately, we're able to customize with our platform simply because, yes, we use a centrifuge, but we also have a hood. And so in between various cycles of centrifuging, the product is brought into the hood where specific layers are taken out that have been shown to be much more dense in terms of platelets or stem cells. So the product is not only more concentrated, but again, we can customize that. Somebody who's younger may not need the same concentration as somebody who's older. Less severe arthritis or less severe tears may need a different dosing than more severe. So again, the customization process really does impact outcome. Cell source is also important, at least in regards to stem cell. The only vetted and FDA-approved cell source is bone marrow. There's other products out there such as fat, which does show a lot of promise in terms of stem cells. But at this point, that particular procedure is illegal. The bone marrow stem cell has been vetted and researched much more than any other product out there. And ultimately, the research tells us it's safe and it's very powerful at treating these orthopedic issues. And again, the research really backs that this is a very excellent source for outcome. We've also learned through our research and trial and error, various techniques that can help optimize, well, in this case, stem cell again, number of stem cells. We have found that by taking smaller amounts from more sites in the aspiration process, we can increase that concentration of stem cells significantly. So again, we found that the number of stem cells matter. The more you can harvest, the more you can actually apply to the injury. Again, the better the outcome. And once again, dosing is important. We are able to count the number of cells prior to re-injecting. And we have found that if we don't have a specific number of cells, that individual may not do as well. And this becomes particularly important for a lot of folks getting this procedure, have more than one joint that they want to get treated. And so by the process of having technology to count the number of cells we have, we can ensure that the person's going to get the best outcome, and whether or not we can do 2 different joints. Now, we've touched upon the importance of image guidance. I won't go into too much detail here, but ultimately, without image guidance, this technology simply does not work. Now, jumping into the research component, again, this data registry really is the foundation and the heart of research. And essentially what it is anybody who goes through a Regenexx procedure will be invited to join this registry, which just means that you're going to get questionnaires over the course of time assessing how you're doing. And again, this is how we measure and monitor outcome. And as I say, this really feeds all of our research. In fact, Regenexx has published 44% of the world's literature on this topic. And again, it all starts with the data registry. And this way we can supply specific and accurate information. We're not guessing. And again, research is really integral and critical to ensure that we are giving the best product possible, as well as to evolve the field. Again, this is still very young. So the data registry has supplied all of our clinical research. And again, we've done research on ACL tears, on arthritis, et cetera, et cetera, et cetera. Again, it's this research that helps verify what we're doing either works or it doesn't work. And obviously, if it's working, it can also help us, make it work better. Likewise, the lab research is critical as well. Again, we have a university-sized research center at our Regenexx headquarters in Colorado. We're constantly trying to tweak the lab process to improve the product, to supply innovation. And again, ultimately, this leads to better outcomes. What we're doing now is much better than it was just 10 years ago. And in 10 more years, certainly this could be better yet. Anybody who's an affiliate of Regenexx is a specialist. Our world is orthopedic medicine. This is our passion. This is what we love to do. And these are physicians. There are many clinics out there who you'll see a generalist. You may not even see a physician. You may be a nurse practitioner or a physician's assistant. And these people, may not have the same expertise as somebody who devotes their entire practice to orthopedic medicine. And again, that experience, that specialization really does improve outcome. So a typical procedure flow in the case of a platelet injection, it all starts with the initial evaluation, where we set aside an hour to meet the patient, listen to their story, examine them, review any films that may have been done, as well as possibly even do some ultrasound imaging, and then provide that individual with a prognosis of what they can anticipate from the procedure and how well they can expect to respond to it. And if that individual decides to go forward, the PRP is relatively simple. It starts with a blood draw. Once the blood's drawn, it takes about an hour or so for it to be processed in the lab. So approximately 2 hours after the draw, they come back in for the re-injection. Oftentimes, we'll put that individual in physical therapy afterwards to work on the mechanical deficits that I was implying to you earlier. And then we typically set up a follow-up appointment 2 months down the road. The stem cell, very much the same process in regards to initial evaluation. But then the procedure is quite a bit different. Instead of a 1-day procedure, it's a 3-day procedure, starting with a pre-injection where we inject an irritant into the tissue. And what that does is it prepares the tissue for the stem cell that we usually do approximately 2 days after the pre-injection. And again, the stem cell starts with the bone marrow aspiration. We numb up the individual thoroughly. And then once the aspiration is completed, the bone marrow goes to a lab where it takes a few hours to process bone marrow. There's quite a bit more to the processing part. So we usually do the aspiration in the morning and then have the individual come back in the early part of the afternoon where we do the re-injection. And that's followed by a third procedure, usually 2 days after the stem cell procedure, where we place more platelets into the tissue. And in that case, again, we get the platelets from a blood draw. And then like the platelet procedure, that's typically followed by physical therapy, and then we'll do a follow-up 2 months later. So real quickly, we'll go over some of the stem cell hype. Like any new technology, there's a lot of excitement out there. And a lot of times that excitement brings along bad players who are not necessarily looking to better the technology, but just trying to make a quick buck. And I would say the biggest culprit we're seeing in this regards is the amniotic world. Whether it be called amniotic or placental or cord stem cell injections, in quotes there. It's important to understand that any procedure done here in the US, this type of procedure is not actually live stem cells. In fact, there's been multiple university setting labs who have studied this product, including the Regenerative lab, and have ultimately tested it to be dead tissue. There are no live stem cells. And this has become such an issue that the FDA several years ago has regarded this as a dead tissue product. And so anybody who is calling it a live stem cell is committing fraud. And this has reached a point finally that over the last couple of years, the FDA is cracking down on these clinics and actually shutting them down and fining them. Now, it's not to say that the amniotic products don't have some regenerative potential. They do have multiple growth factors, which can provide healing. And so, some people do respond to this, but it's also important to understand that the degree of growth factors in the amniotic product pales in comparison to a simple platelet procedure. So in terms of power of impact, it can't compete with a platelet procedure, but oftentimes is quite a bit more expensive than platelets. Many of these procedures are done in chiropractic offices without guidance by a non-specialist, a PA or a nurse. And again, these are dead cell products, and these are not inexpensive procedures, oftentimes 3 to 4 times more expensive than platelets. One marketing strategy that they love to use is that they'll tell you that your stem cells are just simply too old, and that you need amniotic because these are young stem cells. Well, Regenerative has done its own research and has found that older patients do just as well as younger patients. We all have stem cells. If we got a pulse, we have stem cells. Again, the outcome for older patients tends to be no different than younger patients. But again, understand these quote unquote stem cells that they're trying to sell are dead tissue products. So red flags to consider while you're doing your research. Any clinic that's offering heavy discounting or a heavy emphasis on financing, that's might be something to keep in mind. Magic cure-all, this would be a huge red flag. Understand, there are some clinics that are trying to tell folks that they can treat anything from cancer to neurological diseases with amniotics, and it's just simply not true. There's no research to back that. So huge red flag if you run across a clinic advertising that. They also say that everybody's a candidate. With our Regenetics, with our new patient evaluations, we will let people know if they're poor candidates, bad candidates, good candidates, fair candidates. In many of these clinics, everybody's a candidate. Everybody's going to do well. Again, if they're calling it a stem cell, huge red flag, whether it be amniotic cord. And again, any clinic who's providing fat stem cells, this too, although it does show a lot of potential, is still currently illegal in this country. So who can you trust? I came across this website a few years back. This used to be an excellent resource to vet various clinics that's offering these procedures. I just went online the other day though, and it appears that this no longer exists. So I apologize, I got to update that slide. So in summary, we have found that certainly in our clinic, this world of orthobiologics has been a very powerful alternative to surgery, and really can get people back up and moving and doing the things they want to be doing. The combination of regenerative medicine with interventional orthopedics is a very powerful tool to obtain this. Regenetics has been here a lot longer. They are in the forefront of research. As I did all my research, it really proved to me that they really had the best system to optimize the best outcomes. And then finally, be cautious of the magic stem cell approach. So that's the bulk of the presentation. We'll go into question and answering next, but I do want to leave this on the screen. And certainly if you have any questions, or if you want to come in to see if you might be a candidate for this treatment, either give us a call or send us an email. So with all that, let's open up the stage for questions. And again, all you got to do is just simply raise your hand electronically, or if Dana has any written questions, she can tap in and propose the written questions. So any questions at all? A lot of information out there. Looks like we have a question. Oh, kind of coming in and out here.
Okay, Dr. Richneck, I have a number of written questions here.
Here's one from John. Oh, is somebody on there? There.
Go ahead and address John.
John, can you hear me? Hello? Go ahead and unmute yourself there, John. And could be a technical issue. Well, while that's rolling back up, go ahead, Dana. I'm not sure why that's not possible.
Okay, well, one of his questions was simply, does United Healthcare Medicare Advantage cover this? And I started answering. I'm not sure if that is his question. It looks like he's unmuted right now. John, are you there? Can you hear us? Okay, well, the answer is that mainstream insurances, Medicare and other insurances do not cover the procedures. There are several corporations or numerous corporations that have self-funded insurance programs that are beginning to cover the procedures, but Medicare and insurances such as Blue Shield, Blue Cross, Aetna, et cetera, do not cover the procedures.
But they will cover.
Dr. Rich, go ahead.
They will recover. That most insurances will cover the initial evaluation, the consultation, and most of the time they'll cover all radiological studies. So most of the workup we can do and the evaluation itself, and in many cases the follow-ups, insurance will cover, but the procedure itself will not. I mean, at this point, there's not even a code for these procedures, and until that happens, regular insurance just simply will not cover it. But interestingly enough, we've come across more and more patients who have had HSAs that do seem covering. So that is another avenue that some people might be open to some people.
Okay, it appears as if many people are using the Q&A function, which is just a write your answer and receive a written response. To ask a question directly to Dr. Richneck, please use the raise hand feature. So if you don't see it at the bottom of your screen and you see the 3 dots for more, go there, press more, and then go to raise hand. Because at this point, it looks like there are 11 questions in the written question and answer queue. So now I see that John has raised his hand again.
Is Patty, are you there, Patty?
Yeah, I'm here. Can you hear me?
I can hear you, yes. How are you?
I'm good. I'm glad for this information. Thank you for taking this time.
Of course.
So I've talked to you about having my neck done. I need my neck and my lower back done, but I'm curious, I'm having so much trouble this year with headaches. If you've had patients that have had their neck done, if it's improved their headaches.
Well, so headaches are very common in issues of neck issues. And so, oftentimes the process of addressing the issue in the neck, it can stabilize things as well as address pain. And with that, address their neck pain or their headaches as well, I should say.
Awesome.
So yeah, commonly can affect headaches. Absolutely.
That's very, that's inspiring to me. Thank you.
Yeah, no, thanks for the question. All right. Well, let's see. It looks like John, can you hear me? John? I think John's having some difficulty with this, maybe the technology, I'm not sure. Let's go on to Catherine. Can you hear me, Catherine?
Yes, I can. Good evening.
Oh, yeah, hi, how are you?
I'm well, thank you.
Good.
I'm curious about the downtime and what we can expect after the procedure. I'm assuming, in this case, let's go for both stem cell and the PRP.
Yeah. Well, so it's not unusual. I mean, again, what we're trying to do with both is to reboot this whole healing response. And that oftentimes, starts with just, it almost feels like you've injured it sometimes. And that's the effect of acute inflammation at work, which is really the foundation of healing. And so it's not unusual for things to flare up. I mean, especially after stem cell, but even platelets, like in rotator cuff tendons and that type of thing, can flare people up. And most of the time, that kind of runs its course within 3 or 4 days. Sometimes it's a little longer. Sometimes it could be up to a week. So everybody's a little different from that standpoint, but absolutely can kind of flare things up for at least a brief period of time.
Okay, and then do we need any equipment? Like looking at having my knee done, and I'm told I'll need an offloader.
Yeah. So knees and sometimes ankles, we do find benefit from unloading the area that's being treated. And that's important from the standpoint that what we're trying to do is minimize the stress of where the arthritis is and where the stem cells are being placed. And we usually have folks wear that for 6 weeks. We would, if a sufficient brace was available, we would use it for hips, but we just haven't found a brace that's effective. But for any other, whether it be spine or upper extremity stuff, we don't typically need to brace. It's strictly just ankles and knees.
Okay, and then I'm sorry, one more question.
Yeah.
Every person is different, but what would be the general expectation in terms of how long you'd need physical therapy after a procedure? And what would that look like? Would it be every day, every week, every month?
At the start, it might be once to twice a week. As things are progressing and you're progressing with the stabilization, the strengthening program, restoring, functioning of the joint, then, I might go down to once every other week, that type of thing. I mean, it really just kind of depends on how the individual is progressing. And, ultimately the idea is to complete the training in terms of the right strengthening process. And once that's completed, then the key is really just to do that at home. Once you've gotten the training, you don't need the therapist anymore. So once that's done, you stop the therapy, but then the work continues at home. What the homework is really the key to optimizing effect from the exercises.
Okay, and will there be effect on range of motion?
Yeah, absolutely. Yeah, no, that's a good point. I mean, in many cases, whether it be knee or hip, shoulder, what have you, it'd be important to restore as much range of motion as possible. Absolutely. Okay,
I don't want to hog the speaking time, so I'll back out. Thank you for answering my questions.
Okay, well, thanks for the questions. Okay. Let's see here. Let's see. Anita, can you hear me? Anita? Let's try that one more time.
Hello?
Oh. Hi, Anita?
Yes.
How are
you? Hear me?
I can hear you, yes.
Okay, great. I have a question. If you have both knees bone on bone, and and you pick the right treatment for those knees, would the knees be done one at a time, or would they be done together?
Well, I mean, it really kind of depends on the severity.
Uh-huh.
So, I mean, in many cases, we do both at the same time. Again, depends on severity, and we oftentimes don't know the severity until we have an MRI.
Okay.
Yeah.
And one more question.
Yeah.
Is there a weight? Do you have to be a certain weight to have your knees done, or it doesn't matter? Or
well, I mean, I would say weight does matter.
Mhm.
I mean, interestingly enough, we've discovered that for every pound loss, it's almost like taking 5 pounds off the knee itself.
Uh-huh.
So weight can make a big difference. And yeah, it also kind of feeds into who makes the best candidates for these procedures. And, two of the most important things that I like to review with folks is just, how you basically are encompassing how well you're taking care of yourself. So,
Mhm.
you know, a good diet and a consistent movement program, whether it be walking or working on a stationary bike, are very important in terms of optimizing your own healing potential and optimizing the number of stem cells that you have naturally in the body. It kind of plays into, you know, the better you're taking care of yourself, the more likely you're going to be able to you're going to respond to this type of procedure. And another thing that just to add to that, there are many people who, you know, they lose 10 pounds and their knees feel significantly better. So weight does make a difference.
Okay. And are there any side effects?
To the procedure itself?
Yes, with the shots.
Yeah, I mean, from the cells themselves, no. I mean, by far, the most research in this field has been devoted to safety. And, you know, what we've discovered through all this is that these are very safe procedures to do. You know, like any surgical procedure or, you know, interventional procedure, infection is always a risk, but stem cells and even platelets to some degree are, you know, lower that risk. You know, it's far less risky to get an infection from a stem cell or platelet procedure than, say, from a simple cortisone injection, because you know, stem cells and platelets bolster that immune effect that can fight off infection. So from that standpoint, they've proven to be very, very safe.
Okay, thank you.
Okay, you're welcome. Thanks for the questions. Let's see here. Sally, can you hear me?
Can you hear me?
Yes, I can hear you. How are you?
Okay. I'm just wondering if spinal stenosis is something that is helped with these procedures.
Well, a good question. And, you know, 5 years ago, I would have said, no, not really, because it's such a mechanical issue. But we're finding that there's usually 3 components that contribute to spinal stenosis. And spinal stenosis, for anybody who doesn't know, it's just simply narrowing of the central canal. Most of the time, it can be related to bone spurs that are stemming from arthritis of the joints surrounding the canal. Other times, it's contributed to by bulging discs. Now, the third component is something, it involves a ligament, specifically the ligament flavum. And, you know, if a thickened ligament flavum has been found to contribute, you know, to a significant degree to the stenosis, we have found that we can treat that ligament with platelets and tighten that ligament up and help reduce stenosis. So in fact, yeah, I mean, this is an effective procedure for stenosis, particularly if that ligament is a big component to it.
Thank you.
You're welcome.
I also have arthritis that's appearing in all the joints, but the worst is the feet. I just refused a surgery to fuse the joint on my arch, on my right foot, because I didn't get enough information from the doctors about exactly what they were going to do.
I see. Okay.
So, you know, I don't know. It sounds to me like you could help with that problem, but
yeah, no, we work on feet all the time.
yeah.
And again,
stenosis is the one that frightens me.
as far as surgery goes.
Yeah, it frightens me for the future. But the problem with the feet means I can't take a walk around the block right now. So I'm looking for a solution so I can stop, so I can get more exercise without punishment.
Right.
Yeah.
Yeah, I mean, we treat a lot of different, you know, joints in the feet, whether it be the ankle, the true foot, you know, foot joints lower than the ankle, even some of the joints in the toes. There's a lot of different things we treat for sure.
Okay. I guess I just have to talk to someone outside of this context to get a sense of how much it'll cost and what it'll involve, because I'll have to pay you with cash.
Okay. Yeah.
So,
Yeah. I mean, if any of you have any other questions, don't, that come up after this seminar, don't hesitate to give us a call and we'll get those addressed.
because my specific questions are more about me and not about the subject. So I think I'll probably just come in for an evaluation and talk to you then.
Yeah, I mean, that'd be the best way to really see if you'd be a good candidate for this or not. And if you have imaging, certainly bring that to the appointment and we can, look at the imaging, kind of listen to your story and do a full exam and try and come up with a plan.
Do you do your own imaging?
No, in terms of x-rays or MRIs, no. We don't have that facility here or capacity here. We do have ultrasound imaging that we do quite a bit, but oftentimes the MRI and or the x-rays are important too.
Okay, so how do you guide the needles once you're at that point? What's the technology that guides them?
Yeah, so more times than not, we're using ultrasound imaging. But
Okay.
we'll also use x-ray imaging too. We just do x-rays for diagnostic purposes. It's strictly for guidance. Okay,
so I would have to bring my own x-rays in, or you could send me to a lab to get an x-ray if you had to, I suppose.
Sure. Yeah.
So,
I mean, especially if you're a PPO or Medicare or something.
I'm on Kaiser.
Oh, well, so if you want insurance to cover that, you'd probably have to talk to a Kaiser doctor.
No, I know they won't. They aren't going to cover it. But I'm going outside of system, so I'm sure it's annoying. But anyway, it's just I'll just have to do it myself. But
I mean, if you've seen it,
I'm just interested to hear that you need me to bring in my x-rays. I'll have to get them.
Yeah, and oftentimes if the x-rays have been done already, we can get them from Kaiser. And they're pretty good about mailing it out to us. Or, the more direct way is just request it from them and they can supply you with a CD.
Okay, that's the plan then. All right, well, thank you. We'll be in touch.
You're so welcome. All right, take care.
Bye-bye.
Bye-bye. Okay. Let's try, is it Glennis? Can you hear?
Yes, it is. Yeah, it's Glennis. Oh, let me turn on my, it doesn't matter. Yeah, so I had a question about more of the evaluation process and determining, a good candidate or not. What I have osteoarthritis in both knees and would love to get both done at one time. So if that would be possible. And then I am not in the country right now, so I'm wondering if I can do a virtual visit with you to do an evaluation, and I'll have to go get, and then what kind of imaging is best for you, and I can get that done beforehand.
Sure. Yeah. No, we do telehealth visits frequently here, so that wouldn't be a problem. Yeah, if you do have some imaging, if we can get a hold of that somehow beforehand, that really does help the evaluation and making next steps, that type of thing.
Okay, so is the MRI the most important? Do you want MRI and x-rays?
Well, so I mean, if your understanding is that you're in kind of that moderate to more severe arthritis, then yeah, an MRI would be more helpful. Okay. If it's not quite so bad and you've had x-rays, usually, most people have had x-rays, and that kind of gives us kind of a brief story about what's going on. But if it is more, moderate to severe, then an MRI is required, because usually, in that category, we are kind of steering more towards stem cell, not always, but and the MRI really can give us a little bit more information in that regards.
Okay. Yeah, I was looked back and I haven't had x-rays for 6 years, and 6 years ago I was moderate, so.
Oh, okay. Okay. Well, in that case, are you in a country that does MRIs inexpensively?
Yes, actually I am.
Okay. Well, that might be a good solution then.
Okay. Yeah, I'll do that, and I'll be in the office then after that.
Okay. That sounds good. We'll look forward to talking with you.
Great, thank you.
All right, take care. Okay. Any written questions that we haven't addressed, Dana?
Yes. Two. One question is, how long are the stem cells viable after aspiration?
Well, so I mean, in the right conditions, they're viable. You know, if they're frozen or what have you, they can be viable for quite some time. But in this country, there's rules and regulations that require that we re-inject the stem cells the same day of the aspiration, or at least within 24 hours.
Okay, and there's another question asking about research studies. Are there any conclusive double-blind studies indicating levels of success that you can direct anybody to?
Well, yeah, so the Regenix homepage, as well as our website, has quite a bit of research on it, as well as a variety of links. And then there is a blog on the Regenix homepage too that is constantly referring to research, whether internal or outside. So those be two good sources to start with.
Okay, there are no other written questions that need to be answered that I see.
Okay. I'm not seeing other. So if anybody has any further questions, go ahead and raise your hand. And again, a lot of information that we covered tonight. There's bound to be questions that come up, that pop up after we're done, in which case don't hesitate to contact us. Again, phone number and website, or email I should say, is there. Contact us anytime. We can address the questions, or if you're interested to see if you might be a candidate, schedule an appointment.
Thank you.
Okay, well, let's see, it's just after 6, so people are probably bugging out to go eat some supper, eh? Any other comments, Dana, you want to add before we sign off?
No, but it looks like there are a few hands raised. It looks like Anita just raised her hand.
Yeah, I just saw it here. Let me unmute Anita. Hi, Anita. Can you hear me? Anita?
Hello.
Hi.
Hi. I have one more question.
Sure.
God, now I forgot.
Yeah.
Oh man. Oh, okay. Say for instance, if you see my last X-rays, can you tell if I was a candidate if you checked my looked at my X-rays? Could you tell if I was a good candidate or not?
Yeah, I mean, that's part of the evaluation process.
Mm.
But I mean, it's a small part of it, I would say. I mean, listening to your story and of course examining you are probably the biggest pieces of the puzzle.
Mm.
But yeah, I mean, the X-ray does account for part of that evaluation process. Yes.
So can I send my X-rays to you?
Sure, absolutely. Yeah.
Okay. Okay.
Okay.
Thank you.
You're so welcome. Take care.
Mm-hmm.
There's a question from Michelle asking which treatment is recommended with an ACL allograft.
Well, it really kind of depends on the status of the graft. I mean, if we're just seeing some light disruption, then platelets can be adequate. But sometimes we're seeing a little more significant disruption, in which case the stem cell would be a better a better option to get complete healing. But we can address grafts, which is interesting enough. I mean, we can get some healing effect from grafts, but again, it just depends on the severity of disruption. Now I'm seeing Catherine. Let me unmute you. Are you still on, Catherine?
Yes, I am. Thank you.
Yeah.
Okay. This is what I know that you review the X-rays and the MRIs ahead of time to evaluate to see if you're a candidate. With respect to the interventional orthopedics, does that mean you're actually during the procedure guiding the needle by using some kind of imaging the day of the procedure? Did I misunderstand that, or are you just
Absolutely? We're using imaging to help guide the procedure.
At the procedure? Okay, I wasn't sure if you were relying just on the MRI results or what have you that we sent you earlier. Okay, that was my question.
It's live. Everything we do is live imaging, and again, that really is critical to make sure that we get the cells to where they need to go.
Okay, and do you use any kind of dyes or like a barium dye or something like that? Or you just, what type of imaging do you use? Maybe I'll ask it that way.
Well, so I mean, if we're treating like an ACL tear, for example, we'll oftentimes use a dye to make sure that we're in the tissue. And in that case, we're using X-ray. Or if it's a bone procedure, we might use a little bit of dye, but apart from that, we don't typically need that.
Okay, so how can you X-ray people while you're working on them in the room? This is probably, maybe if it's too deep in the weeds, don't worry about answering it, but I'm just trying to figure out how that works.
Oh yeah, not at all. I mean, it's so understand it. It's not like a full-on X-ray. It's called a fluoroscope, which it's a lower dose of radiation first and foremost, and it can give us a live picture. So, in order to treat the tissue, we got to make sure that we're in the tissue. And if it's a deeper structure, like an ACL, for example, which ultrasound can't penetrate, then the X-ray just ensures that we're in the right spot because it can penetrate bone. And it just, it's just a quick pulse. It gives us a picture, and if needle's in the right spot, we test it by putting a little bit of dye into the tissue. And if we're in the tissue, you actually see the tissue light up.
Oh, okay.
Yeah,
Thank
it's
you.
kind of cool.
Okay, thank you.
Okay, take care. Any more written questions, Dana, or is that about it?
That I'm not seeing any other questions that haven't gone unanswered.
Okay. Well, why don't we wrap it up from there? I want to thank you all again for attending tonight. It was a pleasure. And again, as I say, if there's any questions, please don't hesitate to contact us. And if we can help, please let us know. All right, we'll wrap it up there. Again, I want to thank everybody for coming out tonight, and take care. Hopefully we get a chance to talk to you all soon. All right, bye-bye.